cases overnight. This brings the total number to 28. This is concerning, and it demonstrates that the virus is active in our community. We have been expecting this though, and we will continue to see more cases in the coming days. The high levels of testing that we're seeing in our community are giving us a very good level of surveillance as to where the virus is in our community. Yesterday, there were 5,723 tests conducted across the ACT. That is a significant number. Combined with the previous day's testing, it is giving us a very clear picture of where the virus is at this point in time. It gives us strong indication also of the close and casual and secondary contacts that we need to be chasing at this point in time. So thank you, Canberra, for coming forward to be tested in such great numbers. We'll continue to expand our testing capacity, and we'll talk more about that this morning. I want to thank you for listening to the advice of our public health professionals. This is so important at this point in time. Spending the time to get tested gives us the surveillance we need to try and get ahead of this virus. It's been so important in our response. Now, the new cases include at the Lynham High School. The community has already been made aware that one of the confirmed cases announced today is a student. The student is a close contact of an existing case and was infectious unknowingly whilst at school. This means that the entire school community are considered close contacts. We are also particularly concerned about the instrumental music program exposure at the UC Kaleen High School last Monday. However, there are no wider impacts for Kaleen High or the IMP program. We urge anyone who was there at the exposure time to quarantine, but to come forward and get tested. Arrangements are being established to support appropriate testing capacity for close contacts of this school, which we will outline in a moment. Regrettably, we also have an aged care worker who has tested positive. The employee works at the Greenway Views Village in Tuggeranong, and we believe was unknowingly infectious during a shift. The employee had received a first dose of the vaccine. We are working with the facility managers and providing additional healthcare support. The facility is now in lockdown to manage a potential outbreak. We will keep the families of the residents up to date on what is happening on site and the care that will be provided to their relatives. Now, the decision that the government made last week to implement a lockdown was taken to protect our community and to support our strong public health response. As today's figures demonstrate, the virus is active in our community, and there are now thousands of close contacts and a growing list of exposure sites. This is a serious situation. We do not want to see the numbers continue to grow, and we do not want to see exponential growth as we have seen in other jurisdictions. So the best way that we can avoid this is to limit our movement. Please stay at home. Lockdowns are a proven measure to suppress chains of transmission of the virus. They have worked elsewhere in Australia and overseas, and if we do the right thing, it will work here in Canberra. But given the situation that we now face, with a growing number of cases and exposure sites, acting on the advice of the Chief Health Officer, the government will extend the lockdown for a further 2 weeks until Thursday, the 2nd of September. We will, of course, continue to assess the situation each and every day and if we can end the lockdown earlier than the 2nd of September, we will. We are finalising arrangements for the details of this extension and will provide a comprehensive set of information for the community, for businesses, for everyone impacted at tomorrow's press conference. This morning I advised the Prime Minister of our decision, and our governments will work together to provide continued economic support and social support for our community. And again, further details will be provided in the coming days. So finally, Canberrans, my message today is please stay at home. The virus only transmits when people come into close contact with each other. The best thing that you can do to support yourself, your family and friends, and our community is to stay at home. It is that simple. If you have any symptoms or you are identified as a close contact, please come forward for testing. If you do have to venture outside of your home, please be really, really careful. Wear a mask, keep your distance from others, and regularly wash your hands. We'll have further details of the arrangements for the extended lockdown tomorrow, but for now, please stay safe, look after yourselves, and I'll invite the Chief Health Officer to provide some further details of the cases overnight. Dr. Coleman.
Good morning, everyone, and thank you very much, Chief Minister. So as the Chief has said, overnight the COVID-19 situation in the ACT has developed further, but this is not unexpected. We have been talking for the last few days that we do expect to see the case numbers rise. However, since our update yesterday, we have recorded 19 new additional COVID-19 cases, which brings our total active case numbers up to 28. At this stage, the good news is that none of these cases are hospitalised for COVID-related needs, and all continue to be supported by ACT Health and are being monitored and supported closely. We are continuing to work with over 6,500 people who have self-identified as close contacts. This number continues to grow and will continue to do so as our exposure locations grow. And can I just also add my thanks to all of these people who are in quarantine currently for continuing to help us out by staying in quarantine. So, as the Chief Minister has advised, included in today's new cases is the staff member of the Greenway Views Village in Tuggeranong. Overnight, we have been working very closely with the facility, and the facility has been placed into lockdown. Early investigations are indicating that the staff member unknowingly worked 3 shifts at the village during their infectious period, which we believe was from Tuesday the 10th through to Thursday the 12th of August, before becoming symptomatic on the 13th and getting tested. We are working very, very closely with the village to contain this outbreak. Our priority is to minimise the risk of transmission and protect the residents and staff in the village. We are putting in additional safety measures. We have a team out there at the moment, and we are including looking at full PPE for staff. We are communicating with the family and guardians of residents and staff to answer questions and to keep them well informed. However, the primary mechanism of communication will continue to be the village with its community, and we will support the village in doing that. Throughout today, all residents and staff at the village who are on site will be tested by an in-reach team. That is our number one priority after minimising the risk of further onward transmission. Now, this is the first time that the ACT has actually recorded a case in a retirement village or a residential aged care facility. But as I've been discussing, we have been preparing this for the last 12 to 18 months. We have plans in place that swung into action last night when we received the notification. We are also working in partnership with the Commonwealth, and the Commonwealth have experience working in these aged care outbreaks in other jurisdictions, which we are benefiting a lot from. And then secondly, the high school situation. So we also have another one of the new confirmed cases is a high school student from Lynham High School. This student is a close contact of a previously announced case. The student was considered to have been potentially infectious at school from Monday the 9th of August until Thursday the 12th of August. So advice has been provided that any staff, students and visitors or volunteers who attended the school on any of these days between 8:30 in the morning until 3:30 in the afternoon are being classified as close contacts and are required to quarantine for the full 14 days. Their household members also will be required to quarantine as secondary contacts. This is a similar process to that response that we have run for Gold Creek School. As before, ACT Health and ACT Education have been working closely to communicate with the principal and the school community in regards to the case, testing arrangements and next steps. With respect to this specific situation, to provide streamlined testing for close and secondary contacts of both the Lynham High School and the Instrumental Music Program rehearsal room exposure sites, testing arrangements have been organised at Brindabella Park Testing Centre from 12 today till 10 p.m. tonight in organised time slots that have been communicated directly with the school community. This will be replicated at the same time on Tuesday. We would really like to encourage the school community to use this service and also the rest of the community to just support us in getting the school community through this testing so that we can work out how far transmission has occurred in the close-ranging environment. The number of exposure locations venues we have now is over 45. All these details are on the COVID-19 website. Please, as I've reminded every day, we will be updating that at least twice a day. Continue to check in. If you have been to a COVID-19 close or casual exposure location at the specific time listed, remember, fill in the form on the website, follow the public health directions that are listed, and don't delay getting tested. Before I finish up today, I just want to acknowledge excuse me, that I know that this is an unsettling time for us all. This is a very concerning progression, but it's not actually, for want of a better word, particularly alarming. We are expecting to see cases rise. This growth in cases is what we see when we talk about cases coming in to a community where there is very little restrictions on its spread. So we will see a rise in cases, and then as the impact of the lockdown does start to have to work progressively moving forward, those cases will fall. We will get to a point in other jurisdictions that we have seen where the new cases have spent their entire period of infectiousness in quarantine. We do have a little way to get there yet, but we will get there. Just a reminder, as the Chief has highlighted, please stay home. Only leave your home for essential reasons and continue to do so, and we'll continue to support you in that. I'll hand over now to Minister for Health. Thank you.
Thanks very much, Kerryn, Chief Minister. As Kerryn finished on, I just want to say we're all aware that this is a confronting time for the community, and I just want to reassure everybody that we have excellent staff who are well prepared to get on top of this outbreak. They can't do it alone and they need the support of the community, and we've been talking about that for some time. But we have seen that support coming through with people being compliant with the public health directions and with the high testing rates that are continuing across government and private facilities. So thank you very much, Canberrans, for doing the right thing and supporting these public health directions and this public health response. We have increased capacity at all of our testing sites over the weekend to reduce waiting times, but we continue to see waiting times vary across our sites throughout each day. So if you are leaving home to go and get tested, I would strongly encourage you to check the website and the social media feed in particular of ACT Health and Canberra Health Services to get an idea of what the waiting times are looking at like across the sites if you're coming to one of the ACT government facilities. I want to thank everyone for their kind messages to our staff, particularly at the testing facilities, but of course those kind messages also continue for our vaccination staff, and we're continuing to see strong vaccination numbers. So those messages are passed on to staff at the end of each day, acknowledging their really hard work. And I also want to thank people for their patience as we all work together to address this outbreak. Of course, it's really concerning to see a new exposure site at an aged care facility, and lockdown procedures have been put in place, as Dr. Coleman has talked about overnight, to contain the outbreak, and ACT Health is working closely with the village to support residents, staff and their families. The Clinical Emergency Coordination Centre is deploying staff from both Canberra Health Services and Calvary Public Hospital to provide 24/7 care at the facility. And as Dr. Coleman talked about, our CHS staff are also on site to conduct in-reach testing. The Commonwealth has also agreed to support a sustained response, and our officials are working with them to make that happen and make those arrangements. As Dr. Coleman said, they have played a similar role in other jurisdictions, and we are continuing to learn from experiences in other jurisdictions as we respond here in the ACT. Dr. Coleman talked about the dedicated testing arrangements for close and secondary contacts as well for both Lyneham High School students or contacts and staff and students, and the instrumental music program rehearsal room exposure site. So again, those testing arrangements have been organised at Brindapella Park Testing Centre from 12 noon to 10 p.m. in specified time slots. So that will be directly communicated to the school community and the instrumental music program contacts. So a final word from me, and then I'll hand over to the Deputy Chief Minister to talk more about that Lyneham High School response. Just to say that we are having to redeploy staff from across our health services to support the COVID-19 response. And today that has included the closure of the Inner North Walk-In Centre in Dixon. So the Inner North Walk-In Centre has been temporarily closed so that staff can be redeployed to support the COVID-19 response. But maternal and child health services continue at the Community Health Centre in Dixon. And of course, Canberrans can continue to access free healthcare for non-life-threatening injuries and illnesses at our other walk-in centres in Belconnen, Gungahlin and Tuggeranong, with Western Creek obviously continuing to act as a COVID-19 testing clinic. And of course, we'll continue to update the community on any further changes to our frontline health services that are needed to support the COVID response. And again, I encourage people, if they are going to one of our services, to please just have a quick look at the social media feed of Canberra Health Services just to check that there are no changes to the service that you're attending. And with that, I'll hand over to the Deputy Chief Minister.
Thanks very much, Rachel, and good afternoon, everyone. Before I begin today, I just wanted to give some statistics on Gold Creek and the pop-up testing clinic at the Gold Creek School yesterday. So the testing went really well at that school, and everybody was really kind and polite to each other and had significant patience for standing in those queues, but also getting support from the school staff who were being tested there as well, who, of course, whilst education is their priority, care deeply about the welfare of their school communities. And some really great numbers yesterday out of that testing clinic. So on its first day on Saturday, it took 943 swabs, and yesterday they did 1,020 swabs. And I know that ACT Health has been getting in touch with those people at those school communities to see if they can be tested sooner, because they're getting through that testing regime in a really good a really good pace. We also held some online forums for both those school communities, Gold Creek and Holy Spirit. And at the Holy Spirit Forum, there were 435 people who attended. And at the Gold Creek one, there was 948 people, with an incredible number of 722 questions by the Gold Creek school community. So ACT Health and Education are working on bringing all of those questions together for a frequently asked questions information, so that we can provide to those school communities to ensure that they aren't left out. So now on to Lyneham High School. So as I said, these last couple of days have been big and a little bit scary for some of our school communities. And as the Chief Health Officer and the Health Minister has said, we have now a close contact exposure at Lyneham High School, as well as with the instrumental music program rehearsal room at the University of High School, Kaleen. So the Lyneham High School students will now be available to get tested, and their families and the school staff. And at the University of Canberra High School Kaleen instrumental music program, they will also be prioritised for testing as well, because they've been described as a high priority by the Chief Health Officer. Just to reassure people who were at University of Kaleen High School Kaleen, the instrumental music program, the room that they used is very discreet, has a discreet access area, and so all of the rest of the school community at University of High School Kaleen won't be affected by that instrumental music program. And I just wanted to finish, before I ask the Chief Police Officer to come in, by thanking very much the school principals from all of the schools that have been affected so far. Holy Spirit School Principal Brad, Dan from Gold Creek, Rob at Lyneham, as well as Daniel from University of Kaleen High School, who, despite being in quarantine themselves, have been doing a fantastic job at keeping their school communities together and reassuring them and making sure that they have been provided with up-to-date information and supports. So I'll leave it there, and I'll just ask the Chief Police Officer to come and provide some advice now.
Thanks, Minister. Good afternoon, everyone. Firstly, I'd just like to state that the majority of Canberrans are continuing to do the right thing, and compliance in relation to the health direction has been extremely high. We have about 8,500 people currently in quarantine, and my expectation is that number will continue to rise as exposure sites continue to be added to the ACT Health website. Yesterday, ACT Policing stopped just over 1,000 motor vehicles in relation to our Anywhere, Anytime COVID compliance checking, and I again anticipate that number to stay fairly consistent in the coming days. We did check on 145 businesses and houses to make sure people were quarantining. And again, as I've said, the vast majority of people are doing the right thing. But I will remind Canberrans that there is a $200 fine for failing to wear a face mask, and a $1,000 fine for individuals, and an $8,000 fine for corporations that fail to adhere to the rest of the health directions as issued by the Chief Health Officer. Unfortunately, yesterday we did issue 8 infringement notices. That is the highest number ACT Policing has issued on a single day since the commencement of the coronavirus. And 6 of those, worryingly, were on a construction site, a residential construction site in Taylor. So I want to state quite very plainly that we will be doing substantial workplace compliance with WorkSafe ACT in relation to construction sites across the territory to ensure that actually people adhere to the health directions and stay home. ACT Policing also received 140 complaints from either Crime Stoppers or members of the public in relation to compliance, and all those were checked. Again, the majority of them were found to be doing the right thing. And finally, I just want to remind people that 000 is for emergencies. It's not to see whether or not you can cross the border to buy bacon and eggs. So please, can I ask people to check the ACT Health website for health directions, and please don't ring 000. And with that, I'll hand over to the Chief Minister.
Chief Minister, this 1-week lockdown has now turned into a 3-week lockdown. Can you confirm if the index case travelled to Greater Sydney?
The advice is at this stage no, there's no evidence to support that.
Is an investigation underway as to whether they met someone from Sydney in regional New South Wales?
There's obviously extensive case back history being undertaken both by our Health Directorate and by ACT Policing, but at this point there is nothing further that we can add. When we can, we will.
In terms of that investigation, is it more just a matter of asking this person, or are things such as phone location data being looked at?
The full extent of both the police and public health investigation is underway.
So you can categorically rule out that he went to...
I'm not in a position to categorically rule anything in or out, but I can say that ACT Policing and ACT Health have undertaken extensive investigation on this case.
Shouldn't it be a fairly easy answer, though, whether someone was in Sydney or not?
Well, there's no evidence to suggest that at this point.
Chief Minister, are any of the 19 cases announced today from the backlog of processing tests over the Friday and Saturday testing days?
I don't believe so. Obviously, there are some that will have been undertaken by private test providers, but the test turnaround has been generally within the 24-hour period. That's been the ability of our pathology labs to turn around results.
And this morning, residents are still reporting waits of 5-6 hours to get testing. It's been said they should look on social media for updates. Wouldn't a better solution be to upscale your testing so that everyone can go immediately?
We have upscaled our testing significantly, and we've been doing further work to increase the throughput. To put this in perspective, 6,000 tests in the ACT is the equivalent of around 125,000 tests in New South Wales, or around 100,000 tests in Victoria, or around 65,000 tests in Queensland. So it's a massive testing effort across multiple sites, and we continue to stand up additional capacity to respond to specific outbreaks as they occur. But there's a lot of people who want to get tested and who need to get tested, and we are prioritising those. We do ask for some patience and understanding in light of the situation that we face, but we have multiple testing sites, public and private, right across the ACT, with new capacity coming online, obviously over the weekend and in the coming days.
Just to follow up, I understand that you are scaling this up, but Sydney is doing 125,000 tests a day and people aren't waiting 5 or 6 hours. So do we not have the capacity? Is it a staffing issue? Is it a space issue? What is preventing us from meeting that demand?
Well, Sydney took 7 weeks to get to the capacity that they are at now, and in the first few days of their outbreak, people were waiting 18 hours to get tested in Fairfield, for example. So we are deploying all of the resources that we can. You cannot just instantly pop up testing centres. So we've been progressively adding to the capacity of our existing centres and opening new ones, as well as on-site pop-up testing associated with the school outbreaks. So we ask for patience and understanding at this very difficult time. But there are more testing facilities coming online, including in Tuggeranong, as well as an expansion of the capacity at Exhibition Park that we brought in over the weekend, where we're now effectively being able to do a test almost every 30 seconds at that facility.
Just on the 19 cases, could you clarify that we know for sure they're all linked and how many were infectious in the community and for how long? Do we have all of those details?
We have a degree of information in relation to that. The Chief Health Officer has outlined that in her remarks earlier, and as more information becomes available, we will release more exposure sites if new ones are in fact necessary as a result of the contact tracing.
Have any more cases of transmission been recorded from the Fiction nightclub exposure site?
I don't believe so, but I'll invite Dr. Coleman to address that.
Good afternoon again. So we're continuing to progress investigations. As you can imagine, 19 new cases that have come through yesterday and overnight are being investigated as a priority this morning. We do know of 2 instances of transmission at the Fiction Bar and 2 at the Downer Community Centre. So they're the two exposure sites that we currently have recorded evidence of transmission, but I expect to see more.
And on the extension of the lockdown, the Health Minister said this morning that the aim of the ACT is to replicate Queensland's success in suppressing the outbreak. How confident are you that can happen in that 3-week lockdown period?
I'm confident as I can be at 3 days into the outbreak. We are early into our outbreak and we are dealing with what happens when a seeding of a case comes into a community which is not maximally vaccinated and which has very few community restrictions. This is why we have done all the work over the last 12 to 18 months to learn about how we respond. It will take us 2 weeks to get there, at least. That is what we will see, because we need to let the incubation period play out. And I will be able to give you an update every day. I've said before, I make no promises. We are doing our very, very level best here, and I am confident, but that is not a promise that it will do it the way that we want it to do, but I will do everything in my power to do that.
Was the aged care worker vaccinated, and how many of the workers at that facility have been vaccinated? And do you know what the vaccination rate is for aged care workers across the ACT?
So my understanding at this point in time, and as you can imagine it's still earlier in our investigation, that the aged care worker had 1 dose of vaccine. So we are very hopeful that the extent of transmission is reduced and the risk of transmission is reduced related to that. We are still collecting the information that we need on the basis of both the residents and the staff workers in that particular facility from their vaccination status. And I may ask Minister to talk to... You can talk to that? Thank you.
So in relation to the vaccination status of aged care workers in the ACT, it is roughly at the same level as the general population, with a Commonwealth in-reach program to get the remaining workers who are yet to have a first dose to have their first dose before the middle of September. The numbers we're talking about are around 1,000 aged care workers, thereabouts, who are yet to have a first dose. There are obviously thousands of aged care workers, but at least half have had their first dose, which is broadly similar to the general community. We have a program to prioritise aged care worker vaccination through our ACT government hubs, and the Commonwealth obviously has lead responsibility and is undertaking in-reach, as in going to each aged care facility to vaccinate workers, and that program has been running for a while and is continuing.
Just follow up. Do we know if that aged care worker at Greenway works at any other facility?
We're undertaking that investigation. We'll have further information on that in due course.
Chief Minister, on vaccinations, is there going to be a bit more of a push for younger Canberrans and younger people in the ACT to get vaccinated? And just on that, in terms of under 30s, are we going to see them soon become eligible for the Pfizer vaccine?
Well, as we discussed yesterday when the Prime Minister made the announcement of the additional Pfizer supplies, that would mean about another 14,000 coming into the ACT. That certainly helps to accelerate the rollout of our vaccination program. But as I indicated yesterday, with around 80,000 in the cohort 20 to 29, and people needing 2 doses, 14,000 does not cover the 160,000 or thereabouts doses that we would need. Now, obviously, priority workers within the 20 to 29 age group have already received vaccination through phases 1A and 1B of the program, and I understand, around 1 in 5 people in that age bracket have had vaccination. With more vaccine supplies coming in the coming weeks, and particularly through spring, we'll be in a position to extend our vaccination program. We've extended it to vulnerable children in the 12 to 15 age group, and of course to Aboriginal and Torres Strait Islanders who are vulnerable. There's a significant program of vaccination in the ACT. We are the national leader in relation to first doses in particular, and we are the national leader in relation to vaccine coverage of people over 70. But we are limited, like every other state and territory, by available vaccine supply. We will do our best when the supply comes in through our mass vaccination clinics, through the GP network, and through pharmacies and through targeted in-reach into key workplaces to be able to deliver as much of a vaccinated population as we possibly can. But it is, as it has always been, limited by available vaccine supply.
Could I get Dr. Coleman to answer a couple of questions?
Dr. Coleman.
Just in terms of how you arrived at the 2-week extension of the lockdown, as the Chief Minister has just mentioned, more than half of people in the ACT have at least one dose. You've got 85% of people over 70s. Did that high vaccination rate not in any way allow you to potentially curtail that extension to maybe just 1 week?
That's a very difficult thing at the moment to consider and to hang my hat on. We have some evidence of modelling that has been considered by National Cabinet and by AHPPC as well to look at when and how we might be able to open up and not have the hard and fast lockdowns. So as I'm sure you're aware, that marker to at least consider that is at 70%, and that needs to be across the whole population, but we also need to consider that in all of our subsets of population. So while we have some really good vaccination levels in some of our early targeted population groups, as a whole, we still don't reach that, as does no jurisdiction in Australia. So in the response at this point in time, we have to take every precaution, and so I'm taking a precautionate approach here. I think that if there is a possibility that we can pull that forward, then we will discuss and assess that, but my feeling is we will need another 2 weeks on top of this one.
And just on the 19 cases, I understand you've announced some new exposure sites, but we see in other states they very clearly state a number of people infectious in the community versus we're in quarantine the full time. When can we expect that kind of detail with the ACT outbreak?
So we're very early in our outbreak, which means that every one of our cases is infectious in the community. That's what happens for at least the first 7 days of the outbreak. So until we start to see the impacts of that lockdown and our ability to actually be quarantining people and seeing them followed through for 14 days. So I would anticipate that it will be for another 7 days until we're actually able to start reporting that end outcome that we want to see, which is all new cases have been in quarantine. I'm confident that we will get there, but we just need to ride out that wave of those 4 or 5 days of exposure that we had before we picked it up. But just note that we did pick this up very early. We're looking at a window of 4, 5 or 6 days when infectious cases were in the community at the start. So we've started off well.
With the aged care centre in Tuggeranong, can you confirm that all residents have been fully vaccinated?
No, I can't. As I discussed, I'm still collecting that information today.
Do you have any idea what percentage?
No, and I won't even consider guessing at that at the moment.
And can you just confirm how many close contacts have been identified? I think a few numbers have been thrown around during the press conference. Is it 6,500 or 8,500?
I'm not sure where the 8,500 has come from. We are working at the moment around 6,500, but as you can imagine, that is a fluid number. It's very dynamic and it constantly goes to and from. But Minister might know where the 8,500 came from.
So I think it's the difference between, it's the difference between people who are contacts in the ACT and those who are in quarantine. So the Chief Police Officer was talking about people in quarantine. That also includes people who have returned from COVID-19 affected areas in New South Wales. So I think my recollection of the last figures around that was there are around 1,800 people who are in quarantine as a result of having returned from New South Wales.
Minister, how much pressure are contact tracers under at the moment?
Look, this is a big job for our contact tracing team. We're a small jurisdiction and this is a significant outbreak, but they are doing an absolutely amazing job getting through all of those potential contacts that have largely come from the great use of the Check-in Canberra app. And this is a good opportunity to remind people about why it is so important that when you are going out and about, even now for your limited essential activities, that you check in everywhere, every time, because that access to the data really speeds up the process of being able to identify anyone who may have been in one of those exposure locations. And then, of course, there's a job of work for the contact tracers to go through those declaration forms that people are asked to fill in, to identify whether they are genuinely a close contact, a casual contact, to support them to do the things that they need to do. But Check in Canberra has been extraordinarily useful in getting very quickly on top of that and being able to alert people that they are potentially a contact and they need to take action.
Perhaps a question for Dr. Coleman. Have you formed a view or begun to form a view whether there has been multiple entry points of the virus into the ACT, or whether all the cases are linked to a single source, or whether it's just coincidence it got here on multiple occasions at a similar time?
No, is the short answer to that. I think we're day 3 or day 4 today, and with the large number of cases being added overnight, there's a lot of work to be done by my epidemiologist to actually review the current outbreak, to look at all those chains of transmission and to really do that investigative piece of work. At the moment, there are a couple of ideas. It's certainly not multiple incursions. We are looking at seeding opportunities. We are looking at 1-2 opportunities at this point in time.
Yesterday you said you might have an update on wastewater testing. No. Is there anything that you can add today?
It hasn't come through this morning, I'm sorry. I am anticipating the wastewater to be pinging high. That would reflect the large number of cases that we're now recording, so that wouldn't surprise me.
What's the situation at the Magistrates Court, which is now closed, and we've had reports of a close contact there?
I actually don't have any specific information on that, but we could probably look into that for you. Does anyone else? I just might ask Minister Berry, we have a last-minute update on some changed testing arrangements for the school clinics, and I think it's important that the messaging that we're doing out of this presser is in line with that. So thanks, Minister.
Thanks, everyone. Well, so while we've been talking this morning and this afternoon, we've had some updates on those testing times for the University of Canberra Kaleen High School instrumental music program students, as well as the Lynham High School Year 8 students. So the testing times have been communicated to the families of those students by ACT Health. So what they're suggesting is Year 8 plus siblings, staff, adult visitors who are close contacts, that they go and have priority testing at the Gold Creek pop-up from between 12 and 4. So that's the Lynham High School, Year 8 plus siblings, staff, adults, visitors and who are close contacts for Gold Creek pop-up at 12 till 4 today. For Lynham High School students, Years 7, Years 9 and Year 10, you'll be prioritised at the Brindabella Park testing. Year 7 students, 12 till 4. Year 9 students, 4 till 7. Year 10 students, 7 till 10 p.m. tonight. So that's the Lynham High School and the IMP program students at Gold Creek. Years 7, Years 9 and Years 10 at Brindabella Park at the scheduled times. Please make sure that you go at the scheduled times so that the testing can go smoothly. And as I said, all of those families have been advised by ACT Health of those scheduled testing arrangements. Thank you.
With the extended lockdown, what other arrows have you got in your quiver with regard to restrictions if the numbers
as I indicated in my opening remarks, we will provide further detail of the settings for the extended lockdown tomorrow. We're only a few days in, Ian, so it's not a situation where the existing settings have not worked, but the extent of new cases demands going beyond 7 days. And so we will respond accordingly. This is not unusual in outbreaks. Most other Australian cities have experienced this at one point or another over the last 18 months. So we will respond accordingly. What I can say very confidently is that this is a lockdown that the people of Canberra are taking seriously, and it is not following a path that we saw 300 kilometres up the road for 7 weeks.
Will you consider a curfew here like they're doing in Melbourne?
No, not at this stage, no.
We understand snap lockdown has been announced for parts of the Northern Territory. The trigger for that was a man in his 30s who I understand did hotel quarantine in Sydney, then travelled to Canberra airport before travelling to Darwin. Why was he allowed into Canberra?
Related to an essential travel or transport reason. Obviously can check the official record as to that, but it may not have been possible to return to the Northern Territory without transiting through Canberra. But obviously the details of that case can be investigated. But that level of travel, given that there is almost nobody at Canberra Airport at the moment, would have been very low risk.
Chief Minister, is it your preference that federal parliament doesn't sit?
Look, this is a matter that I've discussed briefly with the Prime Minister and the Leader of the Opposition this morning. They need to consider the urgency of a federal parliamentary sitting and whether it is required. They will need to consult with the presiding officers, the Speaker of the House and the President of the Senate. Look, my preference would be that they don't, unless they absolutely have to. And if they did, it would need to be a very minimal sitting and absolutely COVID safe. But my starting point would be now is probably not the time for the federal parliament to return.
Chief Minister, what did you make of the New South Wales Deputy Premier's comments yesterday that the threat coming from Canberra had contributed to that state's decision to lock down entirely?
I made many things of those comments. But look, I think at this point in time, it doesn't serve any particular purpose for there to be a running commentary on each jurisdiction's response. I understand there is an increased risk profile in the ACT. We are in lockdown. We all, of course, know why we are in the situation we are in as a nation, and that obviously the virus has seeded out of New South Wales into almost every state and territory in Australia in the last several months. So I support, as I said on the weekend, the New South Wales decision to go into a harder lockdown. Operation Stay at Home is an excellent idea. It's a pity it didn't happen 7 weeks ago.
The ACT budget's due at the end of this month. Have you made a decision to postpone that?
I think that's very likely. As I say, we will finalise the details of changes to parliamentary sittings, budget timetables, estimates, annual reports, and all of the flow-on consequences for the rest of our scheduled parliamentary sittings. Talking with our Speaker, I've contacted the Leader of the Opposition and obviously discussed this with Greens leader Shane Rattenbury as well. We'll finalise those details, but at the moment the lockdown extends over what would be the scheduled budget day and budget week, so it is most likely that it will be postponed. Okay.
What about Floriade, Chief?
Too early to say at this point. We'll make a further announcement in relation to Floriade probably at the end of this month. We had been putting in place a range of contingency measures. We recognised it would not be a tourism event and would only be a local Canberra event. Goes without saying that if it is not safe to run the event, then we will not run the event. But it's still more than a month away and would extend well into October. So there are a range of options for us. Obviously, all of the bulbs are planted. The flowers will emerge in spring. But how we manage people enjoying that, both in Commonwealth Park and around the city, we'll make some further announcements on in due course. Okay, thank you very much, everyone. Okay, one final question. Yes?
We're getting loads of reports about the confusion. I know in the very first press conference you said if you live in Belconnen, shop in Belconnen, exercise in Belconnen. That doesn't seem to be an actual health direction, it's simply advice. So are you thinking of strengthening that advice so people have to adhere to those rules?
As we indicated earlier, we'll make some further announcements in relation to the operation of the lockdown for the next 2 weeks tomorrow. That was guidance from me for good reason. But I'm not getting massive suggestion that people are just travelling randomly over the territory. People are generally responding well and understand the reason why you would stay close to home. Supermarkets are available all over Canberra. There are many fantastic places to get your hours exercise without coming into contact with other people all over the ACT. So at this point, I just reiterate my message, please stay at home. When you do need to leave home on those rare occasions for exercise or to get supplies, please do so in your local area. That's the best advice we can give at this point.
Could you see construction returning later on in the lockdown?
Again, the reason I said at the beginning of the press conference that we will address those issues tomorrow is to give us time to engage with various stakeholders, to do risk assessments, and we'll make those announcements tomorrow. It's not going to make any difference whether they know today or tomorrow, and so I think it's appropriate to take the next 24 hours before advising the various areas of economic activity what the settings will be. We'll consult and we'll advise tomorrow. Thank you, everyone. Okay, certainly.
Minister, some Canberrans are saying they've been advised to go from the airport testing clinic to Seaford Oval in Queanbeyan. Is that allowed?
Yes, absolutely. Yep.
And do you know where the lines are significantly shorter there?
I don't know where the lines are significantly shorter at Seaford Oval. I haven't got that information in front of me, but obviously that is to enable us to use Brindabella Park as the testing site for those Lyneham High School students, staff and family members should they need to be tested. So that is the reason why people have been asked to go from, I assume that is the reason that people have been asked to relocate from Brindabella Park. We did put out some social media messaging earlier in the day to say that Brindabella Park was at capacity and that people should look at attending other testing sites. So that messaging went out earlier this morning. So it's probably a combination of the fact that Brindabella Park has been busy this morning and also to ensure that we have capacity to do that specific priority testing for those people affected by the Lyneham High School outbreak.
And Lifeline's reporting 150 extra calls a day since the lockdown started. Given the 2-week extension of the lockdown, is the government looking at any additional mental health supports?
Yes, look, we will. That's one of the things we will obviously consider over the next little while. We have in the past put in place additional funding and supports for a number of organisations. What I would say to people is that in this stressful environment, indeed at any time, but particularly in this stressful environment, it is okay to not be okay, and please reach out for support. You can call Lifeline, you can call Beyond Blue. There are multiple places that you can go for support and help and just to have a conversation about the way that you're feeling. But if you're struggling with lockdown, please reach out and talk to somebody. That is really, really important.
Just after the Chief Police Officer. Given the enormous task that you have ahead of you, 6,500 close contacts, compliance measures, do you feel like you have the resources you need to keep across this?
Oh, at this stage, obviously we're talking to AFP National as well in relation to getting some resources from there. I had a conversation with the Commissioner this morning, so we'll reach in if necessary. I've also had a conversation with Defence late last week, and we'll just see how we go in the next week or so in relation to resourcing, but there's a number of options open to me.
Hearing that Canberrans are turning out in droves to Bunnings, certainly not to do urgent repairs, and your officers are struggling to police that. I guess, what is your message to Canberrans?
Well, my message to Canberrans is if you've got a shop, go and get what you need and leave. I mean, Bunnings needs to stay open for essential reasons. There is an app. People can check on the app what aisle things are in. Pick it up and leave. Don't hang around. Don't sort of arrange to meet family members at Bunnings. Go and do your shopping and leave. Stay at home, as the Chief Minister has said, stay at home.
Sorry, Chief Police Officer, have you Have you come across anybody returning from the South Coast or trying to return from the South Coast?
No, we
the last
haven't
couple
at
of
this
days?
stage. I know there's some issues around South Coast, and allegedly a lot of people have, fled down there, but we haven't seen that. Thank you.
And just one more question. Given the number of people who are going from north to south or south to north to exercise, you don't currently have the power to fine them. Would you like to be given the power to do that?
I think the current settings, as the Chief Health Officer has said, will continue to be reviewed. I think obviously it's very early stages in the lockdown. Let's just see how we go in the next few days, and then we can always reassess.